years, it was not popular or politically correct to speak on topics about Christianity or spirituality at secular conventions such as American Psychological Association or American Association for Marital and Family Therapy. And then about 1995, there began to be many topics. Let me read to you some of the topics at a secular convention with an emphasis on spirituality. 1996, the AAMFT conference had titles, Lessons from Love and Life, Hidden Values in Therapy. 3 Spiritual Perspectives on Resilience. Moral and Spiritual Issues in Marriage and Family Therapy Training. Christianity, Ethics, and Family Therapy. Psychospirituality and Couples Therapy. Beliefs, the Heart of Healing in Families and Illness. Soul Healing, Pain and Forgiveness. Working with religiously committed clients is what my colleague and I presented in Atlanta, Georgia. And that's the lecture. I'm going to give you part of that today, and then I hope we will be able to give you the case illustrations of 2 actual cases that I had, so you can see and hear the client talk about the spiritual part of their therapy and how important it was to them. Gandhi talked about the 7 social sins, and these are what he talked about. Politics without principle, wealth without work, commerce without morality, education without character, pleasure without conscience, science without humanity, and worship without sacrifice. Some in America consider America to be founded on Judeo-Christian principles, but now is often called a post-Christian nation. This is what Sir Gibbon, Edward Gibbon, spoke of. He likened the collapse of America, or collapse of Athens, to possible problems in America. He said that Athens was the birthplace of democracy, and in the end, more than they wanted freedom, they wanted security and a comfortable life. And they lost it all. Security, comfort, and freedom. The Athenians wanted not to give to society, but for society to give to them. When the freedom they wished for was freedom from responsibility, Athens ceased to be free. So we all have responsibilities in society. You may have remembered the speech by John Kennedy in his inauguration, one of our American presidents that was assassinated. And he said, ask not what your country can do for you, but what you can do for your country. And Serbia is in a new era, and your country needs you and what you can give to your country as sociologists, researchers, whatever profession you go into. In Western civilization, power is very important, but someone has said power corrupts, and absolute power corrupts absolutely. And often it is power that drives human relationships. Sometimes in certain societies, male-dominant societies, where women don't have a chance for an egalitarian relationship. And a sociologist by the name of Tony Campolo said that rape has to do with humiliating people and with power. But Jesus used power to change the world. And it is sacrificial love, not power, that is important. And if you're exercising power, and that is the most important thing to you, without love, without conscience, without morality, that's the wrong order. I want to tell you a little bit about where I'm coming from. I moved to Salt Lake City. My husband was in the ski business. This is my husband, Dale. And he's going to speak at a business forum in Subotica this afternoon. Yes. He's going to talk about the crisis, the global crisis in America and how that affects the world economy today. But I moved to Salt Lake City, and the dominant religion there is the Mormon religion called Latter-day Saints. And there were a number of people that lived in Salt Lake City that were not LDS, minority population. So I started the first Christian counseling center because people wanted to come to a place where their spiritual background, biblical thought would be combined with professionally trained therapists. And so we had a wide spectrum of clients. We had those from Christian mainline denomination, from fundamentalists, Christian Scientists, Jewish, Mormons, non-believers, and atheists. They all came to our counseling center, which was located next door to the church in a house. And I did training, and we saw many, many clients that wanted someone to respect their value system and their spiritual background. Clergy wanted trained professionals where they could trust the person to respect the values and the Christian beliefs or whatever the religious beliefs were of the client. Clergy often perceive an inherent conflict between psychology, social work, and Christianity. And so they were hesitant to send their clients to a secular therapist. And the tone was first set by Freud, because Freud really did not believe in religion. He believed that God was a myth and that religion was a universal neurosis. He believed that there was a God illusion and that the father figure, God was a glorified father figure. So there were people in the community that wanted their faith to be respected. And church-based counseling centers has been a prevalent method. I imagine that you have them within your background also. And so these centers combine biblical principles with sound psychological principles and training. For example, on our intake form, one of the items was this: briefly describe what meaning your religious beliefs or spirituality plays in your life, and how much do you want that to be an emphasis in your therapy. Some said, I want no emphasis, so we respected that. But many said, my relationship with God is the most important thing in my life, and I want that respected in my therapy. I want you to understand that. So I learned from my training, which was at Brigham Young University, a Mormon university, in their graduate school of marriage and family therapy. I learned how to be immersed in the culture to understand how to deal with LDS clients, because I was not LDS. And for example, often there's depression in Mormon women because there are very high expectations. They have large families, their husbands are away from the home, often in work and then in church work, and the women do a lot of the raising of the children. They're to bake bread every day, they're to work in the church. There are many expectations. So it was important for me to know that about Mormon women, that might happen with women that I saw, because 98% of my clients at that point were LDS clients, because I worked at an LDS university. So it requires an openness by the therapist to be immersed in the culture, to understand it as a necessary inside quality of the therapist. Mnuchin mentions this approach. Mnuchin wrote the book Families and Family Therapy. You're familiar with that book, Structural Family Therapy. He called this the accommodation principle, and that was his technique. And he likened that to the process of an anthropologist. Like the anthropologist, he says, the family therapist joins the culture with which he's dealing. In the same oscillating rhythm, He engages and then disengages. And in a like manner, a therapist working with a religiously committed client must become familiar with the religion of the client and its cultural implications. Right now, for the first time in my life, I'm still practicing a lot of therapy, and mainly marital therapy, and I have a couple with mixed religion where he is a Muslim and she is a Christian. And so I inquire into his beliefs and how his beliefs and values affect his thoughts about marriage and about women, because that's a really important factor for me to understand. So, according to some authors, to ignore religion and spirituality is to devalue a significant part of the cultural life and ethical experience. We can go to the next slide. So for those for those therapists who are trying to understand the integration between Christianity and psychology, there are graduate schools that particularly emphasize this. I was a tenured faculty at Biola University where I taught third and fourth year psychology students in a graduate school of psychology, and I taught them marriage and family therapy, which was a whole different approach than the individual approach, as you know, where we look at family systems. And our school was founded to integrate psychology and theology. And we have a journal called the Journal of Psychology and Theology. And there are other such journals. American Association for Christian Counselors is an international organization, and they have a magazine trying to integrate faith and psychological principles, therapeutic approaches. Another one is Journal of Psychology and Theology. So there are some journals that specifically do research and have an interchange between professionals who are interested in integrating the two. In fact, our school was kind of a pioneer in Christian psychology, and our students are required to have a whole year of theology and psychology so that they will know how to integrate the principles of both disciplines. One psychologist recently did a study, and he interviewed 335. He wanted to find out the role of religious issues in the clinical training of several mental health disciplines. It might be psychology, sociology. And so the survey was sent to 335 clinical directors of places like Rosemead School of Psychology, and the majority of the directors reported back that in the course of treatment and supervision, the students had some training in how to approach religiously committed clients. But most of them did not, only 5% had had religious or spiritual issues addressed in their professional education. So only a few of these therapists were trained how to take religious history. Let's talk now about the problem and subsequent rationale for learning to work with RCC. Does religion matter in psychotherapy? Haley, one of the founders of family therapy, you heard the name Haley? No? Okay. He died just a couple of years ago. He was one of our founders and was very well known for supervision and training of family therapists around the world. And so he was talking to John Workington, another family therapist, and he said, Workington said, I don't think the woman would have improved if I had not knelt and prayed with her when she asked me to. And he said, would you have prayed with her if she had not asked you to? He said, oh no, I'm not a religious man. But Haley concludes that the personal crusades of therapists should be subordinate to the goal of the therapy and the desire of the client. Another famous presenter at our national convention was a Jewish man whose name was Rabbi Edwin Friedman. He did a lot of training and supervision and wrote a great book, Generation to Generation. And he applied to the family process to the process of congregations and pastors. He likened them to family systems and gave a lot of good illustrations between the family systems and religious systems. Now, what's the other view? Well, the other view from some secular therapists is that religion has no place in the therapy, and the practice of faith is not important. One study found that 40% of psychotherapists, and of course these were American studies, it would be different, your research would be different, that 40% of psychotherapists believe that organized religion is always or usually psychologically harmful. And psychologist Albert Ellis, who is a rational behavioral therapy, RET, and he's been around for many years, has always felt that religious commitment is in many ways equivalent to irrational thinking, and that the less religious people are, the more emotionally healthy they will be. Well, he's been around for many years as I have, and that's a long time. And when I first heard him, he was very radical about this, and now he has softened in his approach, and he cites a Christian psychotherapist, Brad Johnson, who has applied his rational emotive therapy with Christian thought. And he finds this very helpful, actually. Larson and Larson did a study reviewing 2,348 studies in psychiatric journals, looking for religious studies and research around religious measures. And he concluded that the conviction that religion is harmful to emotional health is based not upon research, but upon strongly held, unverified opinion. And in fact, only 2.5% of these research studies had any religious variables included. Our School of Psychology did a lot of research in the area of measures to be included in research study around religious measures, and so some instruments were developed. But for some, there's a belief that because religion and spiritual factors can't be handled scientifically, they are not valid therapeutic concerns. But Bergen likens this thinking to the entomologist who found a bug he couldn't classify, and therefore he stepped on it. So, next one, please. We already talked about this, the goal of journals and some of the journals that are available. Let's go to the next one. And we've talked about this. All right, let's go to the next one. All right, we'd like to follow this quote. Lovinger elaborates that those who deny the subjectivity in their modus operandi fall prey to the danger of losing control over its influence upon them. If you are not aware that you have a subjective bias in therapy, you lose your ability to have influence over it. And you risk being unwittingly more subjective than those who are aware of their subjectivity. We all have biases. Do you know what your biases are? If you don't, they will influence you, whether you realize that they influence you or not in therapy. And so these are unable to evaluate their work, unable to see the potentially harmful effects of their subjectivity, and at the same time, their failure to deal with the subjective in a counselor's experience overlooks an important part of the client's worldview and culture. And this is very likely then restrictive of what therapy has to offer. We will see a case study of a woman that I saw, and she had seen another therapist previously. The therapist did not have any stated religious background, and so when she began to talk about how important her faith was and the struggles she had with her faith, the therapist really didn't know what to do and was pretty silent on it and said, well, you need to go talk to someone else about that. And so she didn't feel that this therapist really held her views as important, and to get to know her, to get to know her culture, to get to know her religious beliefs. Okay. Gallup conducted a survey on religion in American life, and the question was asked, have you ever had a profound religious experience that radically changed your life in some way? And 70% answered yes. Okay, this is another one. Let's see. Okay, you can just go back and we'll come to this in a minute. And 85% of Americans consider religion very important, or fairly important in their lives. I don't know what it would be here in Serbia.
The same. We have research. It is the same percent now.
About the same now?
Yes, religion is very important part of daily life.
Interesting.
Today.
All right. 95% say they believe in God. And the statement, my whole approach to life is based on my religion, was answered yes by 72% of the general public. But when marriage and family therapists were asked to respond to this question, 62% agreed, and that was a higher percentage than other experts in, say, psychology or psychiatry. But the therapist, researcher dealing with religious issues seems to be underrepresented in practice and research. And a recent Gallup study found that 66% of Americans would prefer a professional counselor who is religious. Okay, let's see where we are on the PowerPoint. Yeah, we'll get to the study in just a moment. All right, let's look at this study. Lambert did a review of 40 years of research and found that extra therapeutic factors, or what clients bring into the therapy room and what influences their lives outside of therapy, are significant to successful outcomes. And those factors might include such things as persistence, openness, faith, optimism, a supportive grandmother, membership in a religious community, or a sense of personal responsibility. And whether a therapist holds similar religious beliefs to her client is not as important. What is critical is that the therapist appreciates the client's faith system. According to Grosch, a study done, values do change in psychotherapy. Not only because patients re-examine their own beliefs, but because they learn to accept the moral values of their therapists. You have an influence. And whether you understand the influence and use your influence and know how you're influencing people is very important. In the light of numerous studies, it's been demonstrated that therapy is most successful when the therapist and patient share similar values. And more important, that the therapist indeed transmits values to the patient. To the extent that the therapist's values are clear, you know what your bias is, you know what your presuppositions are, they can be left in the background while the patient's material is in the foreground. It's imperative that psychotherapists be aware of their religious values or lack of them, and to have the sensitivity to keep them from interfering with explorations of the patient's attitudes and values. Okay, we're going to stop now and see if you have any questions over this part. And maybe we can see if that other tape works.
Video.
Okay, it works.
Yeah, it works.
Okay, we'll wait then. So I would like to know if you have any questions. And discussion. I spoke last night.
postavite pitanje pa će Vanja prevesti.
What do you think about what I said? Could you understand English? Okay. So, do you agree, disagree? You can argue with me. You can disagree with me. I've presented one point of view. Anybody, what do you think?
I agree with you. But I think that it's not just about religion, it's about everything. If you're a psychologist or you're a psychiatrist, you have to understand your patient, and you must not let your personal opinion interfere with theirs.
Excellent. Excellent. That's sort of the summary of what I said. Very nice. You were listening. All right. Anybody else? What about one of the guys in here? Let's hear from one of the guys. Come on, your voice is important. What do you think? No, you don't. I might have to start pointing to certain students if you don't volunteer. I like dialogue. I like to hear what you think. It was interesting. I was part of an American Association for Marital and Family Therapy delegation to China. And we went to Hangzhou, and this was during when communism was most important, and we weren't real free to talk about certain issues. They were sensitive. And when we went to Hangzhou, I found out that there was a sociology researcher on the family. And he was sent out into the countryside during the Cultural Revolution because the intellectuals and the thinkers, the researchers, were sent away. They weren't wanted in the communist society at that time. But he did research on religion and the family. And I wrote a paper. I gave it to him one evening, and I said, read this, and I want to see what you think. And the name of my paper was How Religion Influences the Family and the Positive Influence that it has. And I came back the next day. We had a guy, and he said he didn't want to speak in front of the group. So he pulled us aside, and there were several people particularly interested in religion and Christianity. And he said, my findings are very similar to yours. Religion influences the family in a positive way. And I said, well, could I have some of your research, your findings? And he said, no. He said, I worked for the Chinese government, and they won't let me publish my findings because they were positive towards religion, and they weren't very positive towards religion. Overtly, they were. The guy said, that it was freedom of religion, but we heard from other people it was more secretive, the practice of their faith. So I thought that was a very interesting conversation. A year later, we were in Tiananmen Square a year before the massacre occurred in, 1989 about. Yeah, so we were there a year before, and a year later, there was the oppression and cracking down upon intellectual freedom and so forth, and it was a very difficult time for the Chinese people. All right, any other questions? I'll move on.
I'm just interesting about Mormon. I read something that they
About
Saint Lake City country, Salt Lake City.
Oh, Salt Lake City.
Yes, you work there.
Yes.
And I read that abuse of children is very often in that family. Like Psychiatrics Association write about that. And is it true still because of higher discipline education?
I had the clinical internship. She's asking about whether there's more abuse in Mormon families. I had the clinical internship at Brigham Young University, so I worked for the university as a clinical intern. And the interns before me told me that in a fundamentalist, which is not the mainline Mormon, but it's the old polygamous culture, with several marriages, that incest is a norm there. And that the children are considered a possession of the father. The father has all of the authority and power. And so I had several clients, I had a couple of clients, mother and a daughter, who had been in a polygamous culture, and then they became Christians, and she was severely abused. They were both abused, sexually abused. And so I think there is a lot within the fundamentalist culture. In the Mormon culture, one of the problems, and I think it's probably changing today, I got my degree in '83, but my colleagues said that one of the problems is that when there was incest, for example, that perhaps the bishop would slap the hand and say, "Don't do it again," to the father. But it wasn't strict enough. They didn't understand how devaluing and how traumatic that was to the children, and they weren't firm enough about it. Imagine that's changed with education and with time. So I haven't seen research on it, but they have large families. The fathers are out of the home a lot. There is a male-dominant culture. For the woman to go to the celestial city, she must go through a man. So when there's a male-dominant culture, I think that does affect. But I haven't seen the research on that except for the hearing from other colleagues. Yeah. And pastors in the Christian church also need to be educated about abuse in the family, about incest in the family, because I've had clients who came from fundamentalist families where, again, the male is very dominant, he's in charge, he's powerful, and the women don't have very many rights. And so I have had Christian clients who've been incested also, and particularly in that more conservative culture. So there needs to be education by therapists in church settings, definitely, about these problems. Anybody else? All right, let's move then. And the first case that I'm going to show you is a woman who had quite severe depression. She was a Christian woman who had gone through divorce, and she had a lot of guilt around her divorce. What did I do in my therapy then with a religiously committed client? Because we came from similar backgrounds, I was sympathetic to her beliefs, to her faith, to her talking about her faith. And as we developed a close relationship, she also then was able to talk about her doubts, her struggles, her anger at God, her disillusionment with God. I gave her permission to decide how much she wanted, for example, prayer in the session. We met for 1 year. She did not request prayer. Then she requested prayer, and for quite a while we prayed, either to start or finish the session, and I had her pray also, because it was her request. But then at one stage she was going through wishing she had not been born. She was angry at God, and as she struggled with God, then she didn't request prayer, and I talked about that, and I said, this is up to you, and I imagine right now you're angry with God, and so that influences you. So I let it come from her, and my belief is that if the therapist can be a loving, caring, empathetic person, that the person often can change their negative God image or God representation and see a more benevolent image of God. And this is how that is gradually changed through the therapeutic relationship that's very loving and caring. All right, so we'll call her Susan, okay? Let's listen
Try to really focus and actually focus on Marcia. Make it more like a therapy in a therapy session, and then your emotions will flow.
Well, and I thought we'd review briefly what brought you into therapy about a year ago. As you know, basically my
life had fallen apart in the space of about a year. My husband had left me pretty much without warning.
So her husband left her
about 2
and
months after that, I
divorced.
became ill, and because of the illness, I was forced to leave school and work, and the loss of all that structure just catapulted me into depression.
So you had a lot of things hitting at one time and some major time adjustments to be making. And one of the things that I was thinking about is that you and I do have a similar background in that we both share a Christian perspective. And I'm wondering how that might have affected you in your therapy up to this point, the spirituality aspect.
Yeah, I think it's been a good aspect of the therapy. I think the most helpful thing is that it gives me more freedom to express spiritual concerns that I have and how those relate to my other concerns in life or decisions. And knowing that you share a similar belief system gives me confidence that your response to my sharing will probably be more relevant or applicable than if I were talking to somebody who did not share that background.
Have you ever had any other experience in therapy? I think you said you went one time before and you were concerned that the religious part was truncated from your therapy?
That's right. Yeah, I don't know what the religious orientation of that person was, but when I brought up my spiritual concerns in regards to divorce, she didn't want to address those at all, and I just had a feeling, she really wanted to get in touch with a 10-foot pole and advise me to talk to a clergy person.
Okay, how did that affect you?
It was, well, inhibiting for one thing, and it also, I think, indirectly discounted that part of me, that part of my belief system.
Okay. And some of the things that we've talked about is what your relationship's been like with your father. You've had him in the therapy. You've relived some painful experiences from your developmental years. What is your father like, and are there any parallels between your relationship and experience of him and your image of God?
I would say there's some definite parallels, connections. My father is a very domineering person and very stern person, very serious, very critical, very judgmental, and not relaxed. I attribute more of those qualities to God, the criticalness and the judgmentalness, than I do his love qualities. In fact, it's very hard for me to focus on his love qualities, and that's something I have to make a conscious effort to do now.
So as you are in process, would you just talk a little bit about the process of what you think you'd like to happen in that area?
Wow, what would I like to happen?
As far as your God image,
I'd like to have a more balanced image. It's difficult because, we can't truly know God, and I think we're all going to be a little bit jaded in our perspectives. I guess my primary desire is to develop more of a relationship with God, to where I feel like I do know more of his character and qualities. I know more of what he has to say to me. I know more of, or experientially feel more of his love toward me.
So being able to have a really experiential relationship with God in which you feel connected to him would be important. Okay. Another issue is, has the religious community been of any help to you during this last year? And if so, how?
Yeah, it has been a great help to me. I've, by hooking into that religious community, I've found friends, peers at my own age who've also gone through difficult times in life and are
that you've struggled with some theological issues, and at one point I suggested you go in and talk to the pastor of your choice, since your church has a number of pastors. How did that work out for you?
It worked out very well. It was a good forum for discussion, and I didn't come away with any hard and fast answers or clear-cut answers. I think that's one of the struggles of Christian life is how do we apply the Bible? It's not always black and white. And I think hearing that from another source made my struggle more acceptable, more okay. Whereas, with my father, things have to be black and white.
Okay.
And seeing that there's another reality there, that things are not always black and white in life.
And so getting more than the perspective of your therapist to get the perspective from a person that actually does that every day, all day, and is theologically trained. In regards to your struggles and your anger with God, I'm wondering what it's been like for you to be that honest about all of the emotions that you have, and maybe just share any emotions that you have towards God in this situation.
Well, I've had a lot of frustration and, anger, feelings of abandonment, and it's challenging to say the least. I think the benefit of it all has been that the experience itself has caused me to break through to another level of feeling and experience in life, period. And instead of going through the motions and doing the right thing, so to speak, or what's expected, trying to live at a more real level. And if that includes anger with God, then that includes anger with God. And not always trying to put on the happy face or what I think other people want to expect, what they expect.
So getting rid of some of the pretense, being able to be honest, realizing that love and hate are very close, and sometimes we have both kinds of feelings in a relationship, and being able to voice those in your therapy has been helpful.
Oh yeah, definitely. Knowing that my therapist, you, has also dealt with spiritual issues and they're important to you, the feedback I get from you, it's more food for thought, which is helpful.
Okay, is there anything else that you want to add that we haven't talked about? Hey, thanks for getting this back.
Oh, you're welcome.
I got to close this.
That's what's wrong.
This woman was a very bright woman who was getting a doctorate in languages and taught at the university. And she went through a prolonged depression, but she is teaching again, to my latest understanding. And I think if you can handle your own countertransference sometimes. For me, when she didn't have the answers and she was angry at God and all of this, I observed inside of myself, sometimes I wanted to be responsible, give her the right answers, and I had to hold myself back and let her go through her own emotional process, not be too helpful, not feel uncomfortable with not having all the answers. And I think that's an important piece, learning to be comfortable inside of ourselves and watching our own countertransference and how that might either hinder or help us. Any questions? Any responses as you watch her? What do you think about this woman's story?
Well, I think there's a lot of women with this kind of story or similar, and I think it's a great idea on thing that you have someone to talk to, because there's a lot of women that they're all alone and they have no help, and I think it's important someone to have you and people like you.
Rosemead School of Psychology did a lot of research on God image, God representation, and how that might be related to earlier figures in our lives, like parental figures. And often when the father is critical, harsh, judgmental, unloving, the person projects the same kind of thing on God. And so being a more loving, empathic person, authority figure in their life, allows them to gradually work that through and have a more positive God image. But it's a developmental process. It's not quick. All right, this couple is a mixed religious couple. He comes from a Jewish background. She comes from a Protestant background. They have 2 young children. They were very close to divorce when they came into therapy. They had been in therapy one other time, and wasn't a very good experience in regards to the values and the theory of the therapist before me was that anything you want is what's best for you. And so if you want this other person, another affair, and she meets your needs better, that's okay. And when they came in, I said, I have a bias towards marriage and towards helping you have a better marriage and keep your family together rather than divorcing. And so it was markedly different value system and attitude when they came to therapy. And they'll talk about their therapy. He's in the medical profession. She worked in the library sciences. And I want to ask right now, before I forget, you are undergraduate, but I want to make sure that all of you agree to confidentiality. These are professional clients, and so that means not talking about them outside of the class. You can discuss them with your professor, but the confidentiality, even though I'm many miles away, is very important to me. Can you agree to confidentiality?
Yes.